Hi, good morning. Right now I'm here performing an EBG. So first and foremost, we always check the patient's chart, and then we should be able to obtain any important information. And then once we're done, we always introduce ourselves by going inside the patient's room, and then we should be able to explain to the patient where they being taken up with an EBG, such as telling them that it would enable us to check their oxygen levels, if how are they doing well with the appropriate therapy. So after that, we always make sure we wash our hands, and then after washing our hands, we should wear appropriate gloving, clean gloves. And then once after is we always make sure we check the patient's RD band to help us to ensure the correct patient. So after is we also have to reassess the patient first by obtaining important vital signs, SpO2, the temperature, the blood pressure, heart rate, and even the auscultation side. So moving on, we should be able to do a modified silence test. So first is we should be able to know which one is their non-dominant arm. If we are able to sense this arm is the non-dominant side, here is the appropriate way where we can obtain the EBG. When doing the modified Allen's test, allow the patient to open and close their fist for about 3 times while we occlude the radial and ulnar side. So after the third time of opening and closing of their fist, we should remove our fingers from the ulnar side, and we should be able to notice the arm to have its color back to normal, and also with the pulse, with a bounding pulse. So after that, we have here, assuming this one is a tissue roll, it would help enable the arm to hyperextend, and we should also let the patient know to let their arm to be more relaxed and comfortable. So we should also inspect here the necessary supplies if everything is present or complete, such as the stopper, the gauze, the needle, the safety bag, label, and the alcohol prep pad. So we should also clean the area with the alcohol prep pad in a circular motion and allow it to air dry. And then once it's dry, we should also prepare the needle and the stopper in place. And then with the needle, it should be positioned with the needle bevel up, and we should hold it with a pen or pencil and in a 45-degree angle. So first, we should be able to sense the pulse, and then if we sense the pulse, we should puncture the needle directly to the pulse carefully, and then we should be able to know there's blood going inside the tube. So after is we should be able to apply pressure, carefully remove the needle, and then apply pressure for about 5 minutes, but if the patient is taking up blood thinners, it should be more than 10 minutes. And then with the needle, we should be able to put it up here, push it in the stopper, and then it should be disposed together with the stopper in a proper waste disposal or in a sharps container. So assuming both of them are being disposed, we should be able to have another clean gauze in place to remove any tiny bits of air bubbles or clots, just a tiny small amount of it. And then we should also have the safety cap, and then allow to mix it up for a few seconds like this, and then put it up in a biohazard bag. And then with the biohazard bag, we should also have a label in place, such as this one, with the name and also the date and time. With the ventilation, we either put it up, if the patient is in room air, we put it up on 21%, or if in oxygen, we should multiply it with times 4 plus 20, equivalent to the percentage of oxygen, and then put the label in here. With the label in place already, we should send this one directly as soon as possible, but if you could not do it so, we should have an ice pack ready to prevent any clotting. And then after applying pressure, we have here a clean band-aid. Put it up on the affected side, and then should be there for about 4 hours to prevent any infection. And then once you're done, everything in here should be disposed, and then with the gloves should be dispose it also. Wash our hands, And then before leaving the patient's room, we always make sure we assess the patient. We check their vital signs again, and if the patient is on oxygen, we either check the flow if it's appropriate or if there are no any kinks present. And then if the patient needs any assistance, we can exert our efforts in helping the patient also.